Studies show that 80% of strokes can be prevented by working with a healthcare professional to reduce your risk. Dr. Chintan Rupareliya, an interventional neurologist with Ochsner Health, joins us to give us some information on preventing strokes from impacting your life or the lives of your loved ones. Good morning.
Good morning.
Well, thank you so much for joining us this morning. This is such a thing that affects so many people. So start us off with, like, what is a stroke?
Sure. So the stroke is a disease of a brain. I also like to call it as a brain attack. And that mostly happens when there is a lack of a blood flow in certain part of a brain. Now, there are two major subtypes. The first one that occurs in 85% of the people is called as ischemic stroke, or also the dry stroke. That happens when a blood clot gets into one of the major blood vessels of the brain, and the nutrients and the oxygen do not get to that part of a brain, leading to the deficit in the functions that is performed by that part of a brain.
So I know that's the first type, and we'll get to the second type in a second, but is there a way to prevent that or to lower your risk of that happening?
Sure, yeah. So there are two different ways that I can think of that can prevent your risk of stroke. Number one is controlling your risk factors by working with your family doctor, such as controlling your cholesterol, controlling the blood pressure, controlling your diabetes, and also treating the underlying heart diseases. And there is a second way that I can say is maintaining a healthy lifestyle. Meaning, taking or adhering with a healthy diet, staying active, doing a lot of exercises in a week, not smoking, controlling the alcohol use, and also maintaining adequate sleep.
So if you're doing all of those things, you're setting yourself up for success, but sometimes we know that things are genetic and you may be more prone. Do strokes work like that too? Like if someone in your family has had a stroke, does that make you more likely?
Sure, yeah. We have been seeing more and more incidences of stroke in the young population as well. And there are certain genetic factors that are not directly associated with causing a stroke, but they increases, your tendency of blood to form more clot that in turn may cause a stroke. Gotcha. And we are still, doing a lot of research in that direction and trying to come up with more reasons so that we can effectively prevent them from happening in our young population.
Sure. I mean, so this is happening, like you said, more often in maybe a younger population than it used to. I guess the next question is, what if a stroke is happening? What if you think one of your loved ones is suffering from a stroke right in front of you? What does that look like? So just so that it is easy for our population to remember that, we use an acronym called BFAST, meaning each letter in BFAST stands for certain symptom. The B stands for balance, if somebody is wobbly or having trouble standing properly. E stands for eye, if there is blurry vision or the loss of vision in certain part of your visual field. Then F stands for face, if the one side of face is droopy than the other. A stands for arm weakness. S stands for speech, if someone is having slurred speech, if someone is having trouble finding words. And T stands for time, because that's the time you should call 911 or bring the patient to the nearby ER. That was gonna be my next question is, if you notice any or many of those symptoms, last thing, or first thing you need to do is get them to a hospital right away.
Of course, because every minute counts when the stroke is happening. And, the research from the past says that approximately 1.9 million brain cells die irreversibly every minute when the stroke is happening. So it is very important that you bring the patient to the ER for timely intervention.
Sure.
There are two major ways of intervention. If the patient makes it to the ER within the first 3 to 4.5 hours of the symptoms onset, you can give them a clot-busting medication called TPA or TNK. Or there is another way that is called the mechanical thrombectomy, where you can mechanically go into somebody's brain and pull the clot out.
Wow. I mean, medical technology never ceases to amaze me. Doctor, thank you so much for joining us and giving us those tips so we can be more aware about the risks of stroke. Thanks so much.
Thanks for having me.
All right, well, coming up.